Hi, my name's Cindy Wilk. I'm a graduate of the PhD in Nursing program here at Kent State University's College of Nursing. I'm going to talk to you today about my dissertation project, Development and Psychometric Performance of the Family Willingness for Caregiving Scale. I developed this scale to use with family members of ICU patients who were receiving mechanical ventilation during an ICU stay. A little background about my study is that ICU patients we know have a very complex care need after discharge, and family members often become their caregivers. Family members can experience emotional distress and mental health symptoms that can lead to post-intensive care syndrome family as a result of the critical illness of their loved one. We know there are benefits to engaging family members in ICU care for not only the family member but for the patient and healthcare system as well. But we know that the level of engagement of caregiving usually is more of decision making and doesn't often involve engaging families in the actual caregiving tasks. We also know there was a lack of evidence on how willing family members are to provide caregiving, specifically what tasks they would be willing to provide care for their loved one. So the objective of my study was to develop and test the properties of the Family Willingness for Caregiving Scale, and secondarily to examine relationships among some of the demographic variables for caregiver willingness and their correlation with caregiver willingness. The scale itself is a 25-item Likert-type scale that ranges from completely willing to completely unwilling, and the score ranges from possible 25 to 125. And it asks family members to rate their willingness on different caregiving tasks, including combing or brushing their hair, applying lotion, massaging their hands, for example. The study took place over 3 phases. Phase 1, the scale was sent out to 10 content experts who provided feedback and rated the items, and at that point it was revised and then it was sent out for Phase 2. Phase 2 involved a small sample of family members who had previously had a loved one in the ICU on a mechanical ventilator from a prior study, and they determined the phase validity was acceptable. So the scale then moved on to Phase 3. And in Phase 3, I recruited 100 participants from 3 different ICUs who had a loved one receiving mechanical ventilation in an ICU at that current time. The study was funded by 2 different awards through Kent State University funding, and participants were given a small gift card to participate. The results indicated that most family members were willing to provide care for their loved one. The scores ranged from 46 to 125 with a mean of 118.5, but the median in the mode you could see is 123 and 125, which really indicated a very high level of willingness among most all of the participants to provide care for their loved one. So the histogram does indicate a very skewed data with a low amount of variability, which did make the statistical analysis a bit difficult. The psychometrics of the scale, the reliability was adequate at 0.934 with the Cronbach's alpha result. The exploratory factor analysis indicated that it was a 1-factor solution with 12 items remaining without any subscales, so it was difficult to establish construct validity. More testing is needed for that. The demographic variables indicated that females reported higher level of caregiver willingness than males, and that was statistically significant. There was no correlation between age and caregiver willingness. Experience with caregiving and cohabitation with the patient did correlate with a higher level of caregiver willingness, but that was not statistically significant. And adult children had the highest level of caregiver willingness, but that was also not statistically significant from other relationship types. So the implications for practice for this scale, really, family caregiving should be considered in the ICU setting, And the scale should be left at a 25-item scale because it can provide suggestions for family members, and it still needs further testing to determine the psychometric properties. But we also need to consider preference of the family member and the patient, and each circumstance must be considered individually. Future studies should also examine nurses' willingness to teach family members these tasks. And if you'd like to read more about my study, I had an article published in the American Journal of Critical Care in May of 2024. So thank you for your time.